Hi, this is Dr. Fiona from the Monty and Minx Vets. Welcome to our weekly Q&A sessions, and this week we'll be talking about blood testing. Blood testing is something that I love talking about and I love doing, not because I like sticking needles into animals, but because it gives me an idea as to what's going on with your pet, and hopefully, get them back to their usual selves faster, and I can see their smiling faces and, their waggy tails. So that's why I like doing blood tests. And to get us started, I'll introduce you to our machines. So the one in the background here is what we call our Biochemistry Machine. It checks for glucose levels, it checks for electrolyte levels, and it checks for certain organ function. And our two main organs that we like to look out for are your liver and kidneys. The reason why we like doing that is because your liver and kidneys are important in passing out toxins in the body, particularly when we are probably going to be doing an anesthetic on your pet. We want to make sure that they are in good health and the organs are running up to speed like a computer. If they have any issues, then it can become quite dangerous for us, and we would like to know whether it's too dangerous to put your pet under anesthetic or not prior to us giving them, the anesthetic medication. So that is our biochemistry machine. The next machine that we have here is our hematology machine. So our hematology machine helps us look at your red blood cells, whether you're losing blood. And the other thing it checks for as well too is it checks for your immune system, what it's doing. Even before we might get some abnormal levels in your biochemistry machine, we might actually find that the immune system's reacting to something already with the white blood cell count from the hematology machine over there. So these two, in conjunction with other testing, for example, x-rays and urine testing, helps us to, know generally as to where we might need to, pinpoint our investigation as to what's wrong with Fluffy. You can ask why we might be using the machines to diagnose diseases these days. Like, in the good old days, the vets used to just, examine your animal and then go by clinical signs and diagnose the disease that way. And I'm very impressed by that. I'm very impressed that they're able to pattern recognize what's going on with the animals. And that's the way that they had to do it back then. And it's impressive now. Like sometimes when you have a very experienced vet that's been doing this for decades and they come in and they look at the animal and they go, yep, that's what's wrong with it. Having said that, they're also, when we do it that way, we are playing a Russian roulette game. And there are some diseases which are very similar in clinical signs, but one might be fatal and the other one may not be so fatal and you have a bit of time. So that's sort of a bit of a problem because sometimes in this time battle, we actually don't win. We might lose the animal because the disease has progressed faster and we couldn't get them the treatment in time because we couldn't tell the difference between the two diseases. So it makes us very sad when that happens, and that's why I personally like to be a bit more accurate. I don't like Russian roulette. I don't like risky games. I like to know exactly what's going on and make sure that I'm only dealing with one disease and not dealing with an underlying disease as well too, which can complicate the treatment process as well. So hopefully that should give you an idea as to why vets offer blood testing and give you a bit more confidence that when we offer that, it does help with the treatment plan. On a last note there, if you do get normal results from your blood tests, that's actually really, really good. We're really happy when we do that. It lets us know that, it's most likely everything's all running well. It helps us to sort of tick off some diseases actually that might be causing the issue. So that's actually really good when you get a normal result. So that's all the time that we have for this week about blood testing. If you have any questions, please let us know and we'll see you next time. Bye.